Assalamu alaikum everyone. Welcome back to my YouTube channel. Just imagine yourself, you want to go to a certain place, say a restaurant, and you don't know the address. One answer to that question could be that you should Google it, but that's not the case with medicine. In order to reach that place, you would like to know more and more about the address, like street number 1, opposite to the building B, C block, D road, and district E. That's the case with history taking. History taking is your journey to reach the correct diagnosis. If any step is missing, you might end up at the wrong place. Now, coming back to the actual steps. Now, right after taking a brief consent from the patient, you would take the introduction. First thing is the name. The name of the patient tells about his or her religion and, of course, the gender. There are few diseases which are common in specific religion group. For example, Muslims and Christians practice circumcision in males, so it is a fact that squamous cell carcinoma of penis is very less common in males as compared to that of the other religion. Now in gender, it is very clear that gynecological diseases are only present in female. There are also certain diseases that are more common in males, for example ischemic heart disease, and other diseases like autoimmune disease are more common in female. The second thing is the age. In children, certain tumors are more common, for example renal tumor and infectious disease. In the middle age group, the adenoma of the breast and gastric tumors are more common. In the old age, especially in men, BPH and prostate cancers and other malignancies are most common. Now coming to the social status. Few diseases are more common in people who belong to poor or rich social status. If they belong to the poor group, they might have appendicitis or TB or most of the infectious diseases. And in people who belong to the rich category, they have non-communicable diseases more common than in the poor people, like diabetes mellitus, ischemic heart disease, and asthma. And also, the marital status should also be asked. Few diseases are more common in married people as compared to the other people, like pregnancy related disorders are present in married females. Now, coming to the occupation. Certain occupations that involve long standing can cause varicose veins, and people who work in the cotton factory can have lung disorders. And the address. Now, the address actually tells two things. The first thing is that few diseases are more common, they are more endemic in some areas, like iodine deficiency is more common in people who live in hilly areas, and so they are going to have more and more thyroid diseases. And people who live in areas in which certain infectious diseases are endemic, like parasitic infections, people who are shepherd by profession can have hydrated cyst disease. Second thing about the address is that it will be helpful if you know the patient's address. You are going to have to call him for the follow up, and if he lives nearby, then it would be very easy for him. But if his home is very far, then you would have to suggest different plan of treatment. After the address, you will ask about the mode of admission. It could either be through OPD, that is outpatient department, or through emergency, that is COD. And you will ask about the date of admission. And after the introduction, you will ask about the presenting illness, the illness that caused the patient to come to the hospital. First thing and the most important thing about is that you should ask the symptoms and write only the simple words, not the medical terms. And the second thing is that you have to write all the presenting illnesses, not more than four, all the presenting illnesses in a chronological order. But if they are occurring at the same time, then you can categorize them, then you can prioritize them on the basis of their severity. For example, there is a patient who presented with pain in the epigastrium for 12 days, vomiting for 10 days, and loose motion for 7 days. Right after the PI, the presenting illness, you will ask about the HOPI, the history of the presenting illness. Now the questions regarding the HOPI, you can remember them with different mnemonics like Odipara, Dope Skates, Socrates. The one I prefer is the Odipara version. The Odipara actually stands for onset, duration, progression, aggravating, relieving, and associated factors. The onset of the disease could be acute or gradual, and the duration could be for minutes, for days, or even years. And the progression of the disease tells the character of the disease with the period of time. The next thing is the aggravating factor, which things the patient do and the complaint of the patient is increased. For example, if it is pain, in what position the pain is increased. And the relieving factor is the next thing, what thing is the one that caused the relieving of the complaint of the patient. The last thing about it is the associated symptom. Right after the HOPI, you will ask about the different questions regarding the sign and symptoms of different systems. It actually is called the systemic inquiry. Generally, you are going to ask about the appetite, weight, gain or loss, sleep, and energy. And the other systems like CVS, respiratory, alimentary system, urinary system, nervous system, skin, locomotor, endocrine. You are going to ask the major symptoms regarding all these systems. After the systemic inquiry, you are going to ask the past history. The past history involves any past disease or any past medical history, anything, any medical condition that caused the patient to be admitted in the hospital. Past surgical history, which means any operation he had in the past or any significant disease he has right now or had in the past. For example, hypertension, diabetes mellitus, ischemic heart disease, TB, and arthritis. Now, if the patient is a female patient, you are going to ask the menstrual history. Now, I'll make a separate video regarding the menstrual history in detail, which will be dealt in the future. Next thing is the treatment history. You are again going to ask about the past disease or any drug he is been using. The past disease, he's going to tell about that this and this drug I have been taking. You can guess by those drugs that what condition the patient might have or might had, and the drug could be causing the side effects, the complaints which has caused the patient to come to the hospital. And the next thing is the drug sensitivity. Now few patients are sensitive to certain drugs that can cause certain reactions. The next thing is the family history. You're going to ask about if any family members of yours has any disease, especially your parents and siblings, and all the previous significant diseases you are going to ask like hypertension, diabetes, ischemic heart disease, TB, and arthritis. Now coming to the personal history, you are going to ask about the economic status, habit, drug addiction, special worries, or sleep disturbances. Now it is time for a quick recap. First, we'll take the introduction. We'll ask about the name, which will suggest about the religion and the gender. We'll ask about age, social status and marital status, occupation, address, mode of admission and date of admission. We'll ask about the presenting illness in simple words and in chronological order, and if the chronological order is the same, meaning the PIs present at the same time, we'll prioritize on the basis of the severity. Then we'll ask about the HOPA of each of the given PIs. We'll ask about the onset, duration, progression, aggravating, relieving, and associated symptoms. Then we'll go to the systemic inquiry, asking about the cardinal symptoms of diseases of each system. We'll ask about the general features, CVS, respiratory, GIT, urinary system, nervous system, skin, locomotor, and endocrine. Then we'll ask about the past history, about any past disease, past medical history, any condition which caused the patient to be admitted to the hospital, past surgical history which caused him or her to have any operation in the past, any significant disease including hypertension, diabetes, ischemic heart disease, TB, and arthritis. We'll ask about the menstrual history in females and treatment history, suggesting any past disease, any drug side effect and drug sensitivity, family history, family member having any disease, especially the parents and siblings, and any significant disease in these members which are given above. In personal history, we'll ask about the economic status, habit, drug addiction, special worries, or sleep disturbances. Now, this history alone is not sufficient for diagnosis. Remember, a good history, along with the examination, is able to diagnose the disease in 80 out of 100 times, but still there is a gap, and that gap is filled by the help of investigation. So, hope you like this video. Kindly subscribe to my channel and hit the bell icon. Thank you.
Oh nana, oh nana, yeah. Astaghfirullah. Forgive me.